Okay, y'all, today we're going to talk about acute phase reactants. So what are they? So these are markers of inflammation that let doctors know if there's some kind of inflammation going on, mostly mediated by interleukin 6. So we're going to start with CRP. So CRP, C-reactive protein, it's a good protein of inflammation. It's a good sign, and it'll tell you if this is more of an acute problem, because CRP is elevated very fast and it goes down very fast. So depending on, your patient comes in that's tachycardic, fever, if it'll guide you if you want to start antibiotics or not. So you can order blood cultures and you can order this, and this will tell you faster than a blood culture would. If the patient, is having some type of bacterial mediated inflammation. The other one is ESR, so erythrocyte sedimentation rate. That one, if I remember correctly, like you take the blood, you put it in a centrifuge, and the centrifuge will kind of make everything go down. Depending if there's more fibrinogen or immunoglobulins, it'll make your ESR higher because there's more things in there to make it heavier, therefore bringing it down, and that'll tell you if there's some kind of inflammation going on. So this one is more of like a chronic. It stays elevated for a longer amount of time. It's used in temporal arteritis, and other type of rheumatological problems like lupus, RA, to tell you, if this patient's responding to the medications or if there's still a lot of inflammation going on, and maybe you need to change management. So that's why I think they both are markers of inflammation, but CRP is more like an acute phase reactant, like more acute, whereas ESR can be more of like a chronic type of inflammation. And then the new marker that has been approved by the US is Procalcitonin. It's something that's been used in Europe for many years. But we just recently started using it, and according to the studies, it actually has a higher sensitivity and a higher specificity than CRP and the other markers. So a lot of the studies have been on pneumonia, but it's the evidence is showing that this is a better marker for telling you if this patient is whatever the cause of their inflammation, if it's due to a bacterial infection, and if so forth, then that will guide your your management if you want to pick antibiotics or whatnot. So yeah, this is acute phase reactants. If you have any questions, put your questions in the comments, and I will respond as soon as possible. Thank you.